Today, I want to do a little bit of auricular therapy. Predominantly what we do is, first of all, is just have a look at the ear. The ear is a microsystem of what's occurring within the body. So we look for any sort of abnormalities, first of all, things like lumps, bumps, little blood vessels. Is there any sort of lines? Is there any swelling? We can actually probe around to see if there's any pain. Today we're going to use what's called a point detector or a point Excel. And what that does is it'll give you a noise, and pretty much that noise is indicative of something that's not right. So the ears, being one of the first sort of structures that we can tell as an embryo, will be manifesting or representing all parts of your body. So the Chinese suggest that it was like an upside down baby. So the head being this area, spinal area, sacrum, the little hands and feet, and everything on the inside being the internal organs. And what we do, we sort of go around and feel around. So what we might as well do while we're here is look for any sort of digestive areas. You can see a little bit of. See, these are all your little sort of large intestine regions and a little bit of liver. We do have the needles put in, so you may find that they're going to be a little more active than not. So what we can do, we can either do some acupuncture, so putting some needles into the area, really small ones, or using stick-on needles, little tiny little tacks on them. We can also use seeds, so little Vicario seeds or little silver seeds or little golden seeds. And what they do, they apply pressure to the area. Remember how I said that acupuncture is not always about needles, it's actually stimulus of the points. So the use of auricular therapy is being used a lot with, say, smoking or some sort of addictions, pain management, post-traumatic stresses. I tend to use it a lot with psycho-emotional aspects. So it's a little bit of your sympathetic nervous system being a little bit overactive. Yes, and you know, once in the 20th century, we're all a little bit sort of driven to do a lot of things. Yes, so our work, due to COVID, due to a lot of things, we're very active and we're very more on the stimulus side of things than the relaxing side aspects. So I can see that there's a couple of points that I would probably suggest to needle as such. Now the acupuncture points that we use tend to be a little bit more sensitive than, say, the body points as such. Some people react like little explosions on their ears. But with that said, not everyone's the same. So what we do, we're just gonna. How was that?
Sweet.
A little bit sensitive? It can be. Look,
Bit of a pinch.
Bit of a pinch, yeah. And so we try our best to maintain you as pain-free as possible. I'm just going to pop that over there for you. There's some really difficult ones. These are the ones that go underneath. Okay. How does that feel? Excellent, thank you. Hi, when considering acupuncture, there's other modalities that we can use. Auricular therapy or ear acupuncture, auricular medicine by different names, is one of those systems that we can use. It's one of the microsystems of the body. So a small area of the ear manifesting itself to larger aspects of the body. Auricular therapy is being used extensively for quit smoking, post-traumatic stresses, for pain modulation, or battlefield acupuncture is the other name they give it in the States, and research is showing that it's good for addressing some of the pain aspects. And what it is using the ear as this little microsystem. So initially it was seen like an upside down baby, ear down here, legs and back and what have you. Since then, there's been a couple of developments by leading people like Nogier being one of the Paul Nogier being one of the major components of that, where he then developed it into phases and developed it into its own system in itself. We can use different ways of diagnosing. So one is by pressure, Another one is by using electrical conductivity as such. We can also use what's called the VAS pulse, so a pulse that addresses the area, so we can touch or move things around there, filters, and when the pulse changes, we know that we're in an active point or non-active point aspects. In our clinics, we've used it for quit smoking as such, with good results. We can also use it for psycho-emotional components as well, with some assistance.